Dr. Hawthorne, first off, tell us, what is the Omicron variant?
So the Omicron variant is now a variant of concern. Was previously a variant of interest. Was discovered in South Africa after they noticed in some areas that there was an uptick in the number of cases. And they actually found that the virus has mutated again and actually has taken the biggest step evolutionarily in terms of the number of mutations. One of the major things that they discovered was that there were a significant number of modifications of the virus, in particular in the spike protein, which is where the vaccine has its effectiveness. So there is some concern that the virus may now be able to evade the vaccine associated immunologic changes. And so I know that I'm actually hearing that many of the patients who are coming down with this new variant, that the symptoms are actually milder. So I think we still have a lot to discover about this virus. Right now, all of the vaccine manufacturers, they're getting their hands on the virus to see if their particular vaccine will maintain its effectiveness. It's predicted that it probably will cause some decrease in the effectiveness of the vaccines, but still much to be determined.
Still much to be determined. How do you test for Omicron, and are those types of tests already happening here?
Right. So it's largely our state health department that collects some of these samples. Some of the academic centers also have the resources to be able to sequence the virus. So it's basically taking the virus down to its most basic elements. It's RNA, it's nuclear material, and basically mapping what the virus should look like and comparing it to the original. And so this is happening. It's only a small fraction of those clinical samples that are collected. I think it's somewhere like less than 10%. So it is happening, but probably not as much as it should be.
Do you think that there are already cases of Omicron here that we're just not aware of? Or do you think it's a matter of time before we get cases of Omicron variant?
Well, the world is a small place. We had relaxed, some of the restrictions as far as travel, air travel. And it really only takes, someone coming from an affected area and landing here. We don't know if it is any more transmissible. We don't know if it's any more virulent than some of the other strains. So that's still being looked at. I would imagine that with some of these modifications, that probably it may be a little bit more transmissible, but I'm hoping that it actually really only leads to mild symptoms.
Do you think we're going to continue to see these types of variants popping up from all over the world? And if that does happen, what does that mean for us here in the United States? Are we just going to have to continually test and update our standards?
Right. So, what has been basically proclaimed by many public health authorities is for people to get vaccinated. And we need to make sure that this is a global movement, not just here in the United States, because anywhere that the virus has its opportunity to multiply, it's going to mutate. That's just a part of the viral mechanics. It always is going to lead to mutations. Sometimes those mutations will be silent. Sometimes they'll lead to worse disease. Sometimes it will make the virus less fit and more benign.
And before we let you go, just to make it clear again for folks who may be a little concerned about Omicron, at this point, still too early to say whether or not it is more or less dangerous than the standard coronavirus.
That's correct. But some of the newest reports, the earliest reports, the most recent reports, is that most of the patients are coming down with milder symptoms.
So that's a good thing.
That is a great thing.
Anything else, Dr. Hawthorne, you would like to say before we let you go?
Go get vaccinated.
Very important. All right. We appreciate your time. Thanks for joining us.
Okay. Thank you, Peter.